Good morning, everyone. This is Dr. Ruchi Jain from Nagpur, and we have been practicing predictive homeopathy since 2010. I completed my BHMS from Nagpur, and I have been practicing predictive homeopathy whole and soul. Since 2020, I have been taking sadhana series, session series, and I'm welcoming you all to join this another power pack session where we will discuss the different clinical experiences from my experience, bridging it to what the stalwarts have shared with us. The knowledge we got from the books to bridging it to the experience through the patients we learn. So let's go ahead with today's session. As we all know, we all are here to learn something new and something grateful for the practice of homeopathy so that we can bring the dreams come true of all the visionaries we had in our life. The first visionary I would like to contribute my tribute to Dr. Samuel Hahnemann sir and Dr. Prafull Vijaykar sir, who rightly said कि eyes will never see unless mind doesn't perceive. So cause and effect, the disease and the remedy, the right rubric, everything is in front of us. But just because we lack the knowledge, we lack the perception, we just miss the goal. And this is what goes to everyone. Even if years of my practice, I still might miss some rubric, some observation where the remedy belongs. So let's comprehend it completely. My today's topic is infertility, unlocking the mind of the female infertility cases, and the process will be same, that we will be connecting it through the science, through homeopathy. So what is infertility? Is nothing but an inability to become pregnant. So a couple who comes to you, who has been an active in sexual intercourse and still they fail to conceive even after 1 year or 2 years of their married life. So these are the cases which are commonly on your desk, and these are the cases which have really come up so frequently nowadays that we find it so common as another diseases in the past. Before, it used to be a very rare, in hundreds of women, only a single lady would come with this problem. But now, because of increasing stress and the lifestyle changes, we can see it has also affected the physiology, the human physiology, and the mental and psychological pressure a female goes through. So here we will be dealing with how the process starts. What is femininity exactly? And can you all mention, do you all also agree to me that yes, infertility has become very common nowadays and treating these cases have become a very tedious task. People, they are under a lot of pressure and they also put you also under pressure of practice. So do you all agree to it? That infertility has become a challenge in today's practice. And also, as a homeopath, we have got so many cases pouring down to our practice. So what is femininity? What is fertility? And what is motherhood? Or what can we say? It's a womanhood. So what it is all? So Mother Nature has gifted us with a blessing that this Nari Shakti, this womanhood, has got the power to bring life into this world. We have got the power to generate from a single unicellular organism to a multicellular being. But the whole factory it goes under is in the mother's womb. The mother brings the world livelihood. We all are facing the crisis because somewhere the motherhood is being challenged. नारी हमें उस भगवान ने, हम वो जननी हैं जिसके भरोसे पे ये पूरा सारा युग चलता है. सूरज चमकता है इस धरती पर तो किरण ही है. That is what a female is, the energy source which turns the whole life on this earth, and every creature has got an importance of femalehood. And we cannot deny that we exist because the femininity is alive. So femininity is not weakness. Femininity is not a power of a female. It is a power of a female, I should say. And femininity is not something to be restricted on. And we are all existing because femininity is existing. If femininity is destroyed, nothing will exist on this world, because even a single creature presents have that desire that I should have my progeny and my future generation as strong as I am. But this all takes place in the small uterine cavity, which is there being protected in the female organs or in the female body. A male has got all the strength, male has got all the power, but it lacks the power of developing a single embryo to a multicellular being. The whole capacity or capability by the universe is being gifted to mother. So we have many roles to be defined when we talk it about femininity, about womanhood, about motherhood on this universe. We start as a role of so many roles we have defined. We are mother, we are sisters, we are daughters, we are daughter-in-law, we are mother-in-law. We are playing so many roles in the society. But all the roles are lacking behind when it comes to the miracle of developing a child or giving birth to the child. So everything starts with that femininity or femininity, I should say. So without the birth, nothing will exist on this earth. The cycle has to continue. The chain has to continue. And importance of giving right birth is really very important so that I exist even if I am gone. I may leave this earth, but my progeny will be present to carry forward whatever knowledge, whatever wisdom, whatever experiences I had. So, whatever emotions this motherhood carries is directly transformed to the child. This is a transformation process which goes ahead. And this is a journey of homeopathy. We have to learn through homeopathy how it plays a very important role in the process of birth and death. So we are born here to die, but the birth takes place in this miraculous machine called as the womb. So we have to recognize whatever roles we have to play in the society. We are the important pillars. We are the balance in this earth. So difference is there with the evolving world. Before, femininity was accepted so well by the females, but today females, they just reject this femininity and they feel that they are not ready, they are not capable of taking the responsibility of this motherhood. And as the days are going on, we see in the initial days, almost 50 years back, not very long, but almost 30, 40 years back, when I was a child, we would see that hardly few people were not prepared to get married. Few people were not ready to get conception. But in today's world, we see maximum females, they ignore, they reject this identity of a womanhood. But how all this plays an important role, how these emotions play an important role in our study, let us go ahead. So the maximum desire is the psychotic defense, what we say, that me and my progeny should grow. Me and my progeny should get stronger in today's world. Whatever I have carried should be forwarded to my next generation. So this is the world revolves around. Even a plant leaves a seed behind so that it is not destroyed. The species is being carried forward and species is not endangered. Even the seed has got the equivalent capacity to grow to a fruitful tree. Similarly, a female who is born as a child has got the capability to give birth, to give fruits to the next generation. So this is motherhood. Female has so many roles in this society, and female is fighting in this today's world, starting from the birth and starting, if you see back to the history, we will note that a female has never been weak enough to surrender to the world. A female fights back. A female has been a warrior. Female has been playing a major role in today's society. So female is fighting for the identity of being existent in the society, to be identified as a person with dignity and respect. A female is fighting with the opposite so that they become more active and they are being recognized and being valued on this earth. They have to fight for being recognized, for being appreciated right from the birth. There are so many incidences in the society where we see that there is a strong competition right from the beginning. Everyone wanted to have a male child. No one wanted to have a female child. So female becomes enemy to a female. So female becomes a person who has to fight to its own species for existence. So for recognition, you have to play so many roles. You have to go multitasking. You have to perform so many duties on this earth so that you are recognized, and the maximum recognition, the purpose of existence of female is to enjoy the motherhood. But we fail to perform this role of motherhood when we are existing on this earth. And this whole process is really challenging when it comes to infertility. We have so many responsibilities in today's world. A female is not only restricted to 24/7 housewife job, but also playing so many important roles in different society. She is now a scientist, an astronaut who has gone to the level of universe. She has become a powerful lady who has got all the intellect and management capacities with multitasking skills and stress bearing capacity. They are playing all the responsibilities being given on their shoulders. They are fighting to attain a good position and recognition in this male dominant society. We are all struggling today, but not like in the past. They all have got a position, a respect in the society. It is political, it is medical, it is engineering, or you call astronomy. Everywhere it's being empowered by a female. So there is female empowerment which is coming up as also. So everything plays an important role. All the values which are being given to a female right from the beginning to today's world. Everything carries a meaning and everything carries a value when it comes to femininity. So these value systems, where do they come from? We are born as Indians, so we have got a strong belief system. We are Indian, where we are being prayed. I still remember in our childhood we used to go for Kanya Bhoj, and where people used to touch our feet, wash our feet, and take it as a blessings from our side, because we were being prayed and we were being what I should say. This is the identity of a female which comes from where this femininity comes up, and how to get through it and how to understand this femininity into our practice. So let's understand the normal physiology what God has given us. So if we see normal physiological process, this whole femininity is evolving around the identity of a female, because structurally and physiologically, that is anatomically and physiologically, we are born as female. We have got the structure and function which is of a female. So structurally, we are different because we have got the female genital organs, which the most important role is the ovaries, the uterus, the mammary glands, which make us give an identical identity of femininity. So everything starts from the hypothalamus and pituitary. So there is a strong axis called as hypothalamic-pituitary axis, which we need to understand. The first stimulus comes from the anterior pituitary, that is hypothalamus stimulates the anti-pituitary to release the hormones, that is FSH and LH. So whenever you're treating cases of infertility, please see to it, you check these levels of the hormones which are present. So the main hormones which are involved in the fertility process or in the menstruation process are LH and FSH. we see maximum cases that LH has gone very high. The FSH is disturbed. There are increased serum prolactin levels. The testosterone level in a female is very high. A female fails to conceive. So how do these hormones play an important role? So on the first day of your menstruation, we have a surge of hormones which start because of the growth follicle, the growth stimulating hormone. They stimulate the estrogen and progesterone plays a very important role in developing and building the level of endometrium, which is responsible for the bleeding which we have during the normal cycle. Normally, the cycle has to be 5 to 6 days, depending upon the age of the person also. We have seen that all the menstrual cycle gets affected with the age of the person, with the stress of the person. Why? Because directly the stress affects this hypothalamic-pituitary axis. How and how to go ahead, we will see. So what happens exactly when we are menstruating from the day 1 till the day 14, which is the most powerful day of our life, that is ovulation. This ovulation takes place, and if we are successful in conceiving, this ovulation turns into a embryo or developing follicle, and this gets transformed into a multicellular organism. But if this ovulation doesn't happen, then everything is like the uterus starts weeping. That is what menstruation starts. So the importance is of the follicular phase and the luteal phase, where we are really struggling hard. So there are 4 phases which we need to understand when we understand female. So this is a luteal phase, which is very important. This is the phase where progesterone is very high, right? If the implantation doesn't occur, this is the time where the endometrium begins to break down. I am really not happy because my work, my purpose was to give birth to the child, and now I am not giving birth to the child. So this is the phase where this is premenstrual phase of the female. There is a lot of frustration which comes up. You have seen so many premenstrual symptoms like irritability, anger, mood swings, acne breakouts, skin getting dull. There is fluffiness in the body, the breast get engorged, the hair becomes dry, the skin troubles start, people go into depressive phase, weepy mood. All these symptoms are premenstrual symptoms, which are very strong indication that the purpose of this uterus was not being sorted. There is no implantation. The uterus could not go into a reproductive cycle, and therefore this luteal phase becomes very important into the premenstrual syndrome. And the maximum stress you will see in the other phases of the life, you will see this luteal phase becomes very worst. We have so many important remedies in our Materia Medica, which says leukorrhea 10 days before the menses, anxiety before menses, aversion before menses. There are so many mood fluctuations which are there just before the menses. So a female understands that now she is ready to menstruate. So this is very important phase, because here the mature egg which was being released fails to get fertilized. So this is a frustration because a female is born to give birth, and every time you menstruate, the body is getting frustrated because the purpose is not being sorted. So you will see in a case there are so many. So definitely please check. So when you see patients coming to you with lot of acne apart from PCOD, right? If there is no PCOD in the patient and still the patient says ki I get frequent breakouts, I have lot of fluffiness in the body, there is lot of breast engorgement, you will see that they are the people who have the desire of giving lot of love and nourishment to others. And there is lot of disappointment in their life, and therefore they have lot of premenstrual symptoms which are coming. So then the bleeding phase is very important. This is the first phase of this whole chart, That starts from day 1 to the day 6 of bleeding cycle. So this is the phase where a female starts to menstruate. For a pubertal age group, this is very valuable because how you respond to this phase of life is very important. How a mother takes care of the child, this whole bleeding phase becomes very important. Here, the endometrium is broken down. The bleeding has started. The uterus is weeping and right now is not in a good mood. So therefore, the whole body metabolism is disturbed. So in previous days, if people would say ki don't touch anything, don't do anything, that was because this is a phase which requires rest. It requires the body to settle down all the metabolic processes because there is weak defense mechanism. And therefore, the female was being advised to take rest when she was in the bleeding phase of the life. The body temperature is disturbed, and therefore there was a ritual which is being always followed. In South India, it's a very beautiful culture of enjoying the puberty. They celebrate the puberty, the start of femininity, as good as a marriage period because there is an acceptance the female comes up. Okay, so you have a lot of menstrual difficulties like scanty menses, overbleeding. They all are the crisis because of the endometrium. So here the endometrium plays a very important role, right? Because it is shedding down. So if you have endometrial hyperplasia, you have endometrial thickening, you have a lot of bleeding which is coming up. If it is a thin endometrium, the bleeding is below average. Okay. So thickened endometrium will give you intermenstrual bleed, that is in between the menses, a bleeding will come up, or a delayed menstrual cycle, which will be a result of this bleeding phase, which is getting affected because of the endometrium. Now the follicular phase. This is the phase where the female finds the purpose of existence. The female is ready to procreate. Here you will find the female is having high metabolism, good energy. She looks beautiful because the ovary is maturing. There is a good surge. The endometrium is ready to follow the purpose. The hormones, the progesterone is low, but other hormones are increasing. The follicle stimulating hormone is coming to the peak level. This is a very important phase where the female is getting ready to get fertile. This is a very important phase which we need to understand. And usually a female feels very heavy, very light, very energetic during this phase of life. Then the ovulatory phase. This is another a very important phase of the life cycle of a female because here the endometrium secretes the proteins which are important for the fertilization. Now the female says, ki now I am ready to procreate. Now I am ready to accept the new energy coming within me. I am ready to ovulate because I am prepared. There is a balance between FSH and LH. These two hormones come at the surge on the 14th day. And here you will find the female is looking best of her time. The female has got a good appetite, good energy level. And here the female is somewhere trying to perceive the changes at the physical level. This becomes very important. But today's lifestyle is disrupting the whole process and really hurting each cycle of menstruation. So here, this 4 phases becomes very important. Okay. Then, as we all know, the body is ready to procreate. The body is ready to implant. This is the highest mission of or highest secret plan of the whole universe because the universe is trying to understand what is happening inside the womb. It's the machine which is going to generate everything inside the womb. So this is a miracle which is going to happen and the female should be ready to accept all the phases of this life. And right from the puberty till menopause, a body is preparing itself to have regular cycles. So if you have regular cycles, you are perfectly enjoying the femininity. You are in perfect balance of health and harmony. But if these four phases, they go into imbalance, the diseases develop related to female genitals like infertility, PCOD, menstrual irregularities, hormonal imbalances, leading to so many physical changes at the level of body and mind also. So how it goes ahead? So universe has gifted us with a perfect balance between the masculine energy and the feminine energy, right? So there I always have a question in my mind. Everything we have tried to control, then how this balance is maintained, that there are equal number of females to equal number of males in the society? Why this balance, and how this balance of universe is being maintained in this universe? So there is a perfect balance between the number of females getting birth and number of males getting birth. Imagine that if this balance gets disrupted, what will happen? Only males society will end. You must have recently heard there was a rhino which has extinct the species because it was the only single male who was left out. There was no female rhino to give birth. So how this balance is maintained? How this male is to female balance is maintained? So it is under the universal control and not under the control of the human. We cannot control this. And if we try to control this, then we are bringing syphilis. Every female and male has got equal hormones. So we have estrogen, we have progesterone. Equally, we have testosterone within us. But if we try to imbalance it and testosterone levels go high and progesterone and estrogen levels go down the normalcies, what happens? We lose the femininity, we lose the power to procreate, and this female body, which was born to be a female, behaves like a male. So there is a disruption, there is an imbalance between the two ends, leading to diseases of the femininity. So masculine energy has got certain qualities and the feminine energy has got certain qualities which we are being imbibed through generations into it. So when you talk about masculine energy, it's the logical energy. It is the energy which gives you the power to be more active, be more enthusiastic, adventurous, rational, with all the strength. I don't say that these qualities are not in the female, they are there. But when you talk about male, their body structure is different, their emotions are different, the way they handle the stress is different. When you talk about femininity, they have got a different structure, so they have got different capacity to perceive the senses and react and respond to all the stress also. So when you talk about the Janani, they have got the power to nurture. They have got the instinct, that is maternal instinct, to give emotional support and love and care as to the child or to the family. They are very fragile, gentle, and very delicate, what we say, to be handled with care. But they are equally emotional. Still, they have that flexibility and that yielding capacity, which a male lacks. And therefore, after marriage, a female is supposed to get married and go to the another house, whereas a male is not being demanded that. A female has that capacity. Therefore, a female develops in one house and goes to another house to flourish this whole universal plan, right? So these are all the capacities or capabilities and qualities of a female. But when the imbalance happens, the female tries to adapt and go into the shoes of the male and want to become like a male that is more masculine, and all the process, the disbalances and imbalances start, and a female whose body structure is to be born as a female starts behaving like a male. So the whole universe which has given this balance to us gets disrupted, as we have seen in the case of PCOD, right? There the body is definitely of a female, but physiology is more like a male. You have amenorrhea, you have hirsutism, you have you have obesity, infertility. So many gynecological problems start because we fail to accept this feminine characters. In today's world, what we see is that female is not accepting it. Before, as soon as the puberty would start, the female was supposed to get married, and this ripe uterus, which was ready to conceive, till the time it was fresh, the power, the energy of the uterus was being completely utilized. And before 20 years, there used to be a procreation. But in today's world, this harmony is balanced, and this balance is being disrupted. The female is not ready mentally and emotionally, not prepared to get married. The female says, I'm not a machine to give birth. I am not ready to conceive. I'm not mature enough to give birth to the child. I'm not prepared to take responsibility for the whole family, and I cannot go ahead in this life. And therefore, in this male dominating society, even the cultural differences have come up. The female is being demanded to behave like a male. They have become competitive in today's world. They are fighting for their own existence as a female, as a womanhood in the society. And therefore, this imbalance has happened, and the whole energy is shifted from feminine energies to the masculine qualities. In all the pathologies which have developed. So this is the mind connection, because all the stresses, all the demands which a society has from the females are a real challenge for the existence, and all the belief systems which a female is struggling from the childhood, right from the single cell inside the mother's womb, is fighting for the existence till the birth as a mother, till the death. And all these stresses, all these emotions, they are being buried inside as a somatic memory, carried forward, and they come forward in the form of uglier ways. That is nothing but the diseased form. So all these suppressed emotions, all these fight which a femininity is fighting right from the birth, really makes it a challenge for the survival of a female to behave like a female. So a female tries to behave like a male. So this is what even Hahnemann sir says, that most severe diseases are produced by a disturbance of the vital force through the imagination. So what belief system we are being brought up? What belief system at the genetic level we are being given by the mother? During the womb, how safe we were, how loved we were. The way a female is being cared in the early childhood will give you the result of a full developed femininity. If there is a stress, it will directly affect the body. And as we all know, body never lies. Body will show you the language of the mind. And whatever the stress has been affected, the femininity will get affected. So if what would happen, just take yourself 20 years back, 25 years back. So there were so many cases where there was a male dominating society, and they always demanded that a female, due to discrimination in the society, should give birth to the child. That is compulsorily, it has to be a male child. And there was so much of pressure which was coming from the in-laws side, from the society, that it has to be a male child. And therefore, the whole machine which was developing the child, if the child was a female child, the machine gave the indication that you have got the pressure of behaving like a male. So a male was born inside a female body. So everything was structurally of a female, but body was somewhere behaving to compete the demand of the mother of behaving like a male. So that disruption happened. So you get so many PCOD cases. Friends, if you have PCOD, which has got long prolonged amenorrhea, that is more than 4 months, 5 months, the child needs stimulation, then delayed puberty. If the pubertal cycle has not yet started, it has been delayed. The amenorrhea phases are very prolonged. The bleeding phases are prolonged. Then please go and take the mother's history, because all the symptoms which are there are because coming from the root, that is the seed which is born from the mother. So there has to be an attack on the femininity, and therefore there can be insecurity, there can be fight, and all these things are happening because of all the psychological pressure or emotional pressure the mother has given to the child, and which will be reflected at the physical plane. So ovaries are the most important organ of this whole femininity issue. If whatever we are talking, that is the most important organ which gives an identity. Because now we have so many cases who are coming up with infertility where the cause is in the ovaries or other organs of the body. So let us understand what are the major causes of infertility and how this whole process is disrupted. So there are hormone related problems, that is the ovary is present but it fails to ovulate. So this is also seen in elderly elderly people who are like above 34, 35, they're trying to conceive. So they have got anovulatory cycle because their ovaries are exhausted. The hypothalamic-pituitary axis is not working so properly, and therefore you will see in these cases that LH is very high. The AMH ratio is very high or it is very low, right? So AMH is disrupted. The ovaries fail to ovulate, right? There are another reason then important is that yes, the ovum is developed. The ovum is released on the fertilization phase, but in the transportation, there is a problem. So there are factors which are called as the tubal factors. So you have kinking of the fallopian tube, maybe because of the previous inflammations the patient had. Then you have fallopian tuberculosis, which is a very common cause of tubercular adhesions or a tubal blockage. Then if the ovaries are normal, the cycle is normal, then there is a problem that this tubal blockage is there. So on the investigation, you see that HSG shows that there is no spillage at the pelvic area. So therefore, the tubes are being blocked. And homeopathy plays a very important role in all these cases. Then you have another inflammations which are coming up, like you have torch infections. There are infectious diseases affecting like pelvic inflammatory diseases. There are so many infectious diseases which are affecting the fertilization of the female, directly hitting the endometrium, leading to endometritis or leading to oophorytis. So all these diseases will definitely affect the fertility. Then late conception. The age-related factors are very important. If we are not ready, we are not prepared to conceive, we fail to procreate. Then delayed, voice is gone. So delayed conception becomes very important role in today's society. Girls are not prepared. They say, I don't want to get married. I'm not a marriage machine. I don't want that I should just work and just procreate. I'm fighting for my career. I want to build up a good career in my society, a good image. I want financial security. I don't want to be dependent. I want to be an independent lady. All these problems are creating the major issue is age-related issue that is leading to all the complications or uterine problems. Then there are different factors like uterine fibroids, uterine endometrial issues, the myometrial issue. So different kinds of uterine fibroid. They all also disrupt the uterine problems, and therefore the endometrium is not healthy enough to give birth or stay back, and leading to all the complications which are there, like because of multiple uterine fibroids due to DUB or less of endometrium, that is endometrium being thin, they all lead to the complications of failure of implantation. The ovum has been released, the ovum has traveled through the fallopian tube, but the uterus, here the problem is with the soil. This is not the problem with the seed. When you talk about ovum, the problem is with the seed. When you talk about the uterus, the problem is with the soil where the body is trying to implant itself. So this is the phase where the uterus fails to give that proper medium where the implantation can happen. So definitely sterility is another issue. Advanced maternal age is age-related complication, and immune infertility is another thing which have to be kept into mind. So, okay. So there are so many factors which are important. Here, try to understand with the concept of right seed and right soil. The concept where we have to understand where the problem is. When a person comes to you, you can diagnose exactly where the issue lies and how to resolve the issue. So when you talk about the ovulation problems, you know that the issue is not in the uterus, the soil is good, the season is good. The problem is the seed of the individual. So that is the basic cause. So you have so many diseases related to ovaries, and there the hypothalamic-pituitary axis plays a very important role. Then the tubal blockages, what we have seen, then infections like cervicitis, chronic PIDs, they all disrupt the endometrium, leading to endometritis and cervicitis. This is all we have seen. Then uterine abnormalities में endometriosis में सर हमेशा एक चीज बोलते थे कि endometriosis में there is a strong desire of being a motherhood. There is a strong desire within the mother where she wants to conceive, but there is failure of conception. Okay. Then there are other factors. That is the season, I would say. So there is a right seed, there is a right season, and then a soil, what we see. The season here is the external environment which plays an important role in the fertility of female, the increasing stress, the habits of a female which have become these days a very challenge. Alcoholism, smoking, going into drug addicts, all these are playing an important role in developing all the chronic diseases in the females. Now you have to take each disease into consideration and then decipher in the case. Let's go ahead. Then what are the problems with the ovary? The first problem with the seed is here is anovulatory. So in spite of having a regular menstrual cycle, there can be anovulation. That is, there is no ovulation which is present. Then there is primary infertility. So cases like Klinefelter's, cases where there are genetic and chromosomal gonadotropic hormone which is being affected, the ovaries are not developed. There are diseases where there is genetic mutation and this leads to infertility primary at the level. So the uterus is not developed. This can also be there. That is hypogonadism, what we say. This is also a problem for the ovaries. Then delayed menarche. Menarche is not achieved. Delayed puberty is another cause for the problems. Then primary amenorrhea, that is delayed menarche, will be covered. Ovarian dysgenesis, that is ovaries are not being formed, they are not being developed. So all these problems at the ovarian level, don't take the history, only the constitution of the patient, go back and take, even if required, go to one generation and second generation. Here I will try to share with you a very beautiful example which came to me with infertility case only, but the cause was not with the child or with the patient who had come to me, but there was a tremendous pressure being built up from the mother side. And mother said, keep from generations, we never had a male child. So my mother also had all females. Then our generation, I already had 3 female childs, and now again I am pregnant. So there was a tremendous pressure. So I developed a child. I gave an instruction ki now, because we are being cursed as a family to give only birth to all the females in the family, better not to continue this generation. I was so much frustrated, doctor, that I just wanted to kill this baby in my this generation. I was so much frustrated, doctor, that I just wanted to kill this baby in my womb. And I wanted कि अगर female is being insulted so badly in the society, so better not to give birth and my progeny should not continue because we have been cursed somewhere not to give a male child. So therefore, this case was being cracked when I took the history from the mother's mother level also. And there I took the misfortune inconsolable, the rubric was there. And therefore, the destruction which was given in the mother by the mother to the child was that identity crisis. I was fighting for being recognized as a female in the male dominating society, which was really getting toxic for me. So many complications they arise. Then there is a premature ovarian failure where the ovaries at a very early age, you will see that menopause is being, now we see even 38, 35 females, they have got early menopause. So there is premature ovarian failure. That is, we have seen through, it can be a congenital disease. Even infections like COVID have disrupted this ovarian cycle, and taking too much of hormones also disrupts this ovaries to fail to mature and just ovulate. So these are the ovarian conflicts. Then ovarian failures, they are because the hypothalamic-pituitary axis is being affected. That is hypogonadism, what we see in Klinefelter syndrome or diseases affecting the genetic structure or identity. Then there is a state where the gonads are normal, right? The estrogen level is normal, still there is anovulation. Like first case, actually the gonads are not there, so they are not functioning properly, so there is no proper stimulation, so hence there is amenorrhea. In this type of cases, see, in the first variety, that is hypogonadotropin, जहाँ पे कम है, जहाँ पे hypothalamic amenorrhea है, your only GCS will never work. Take the cause from the seed conflict. That is the takeaway message. Okay. But if you see that the gonads are normal, the estrogen level is normal, still ovulation is not happening. That is PCOD, right? PCOD and PCOS. So here both the seed and the soil both are important. So mother, and the cause is in the mother, and the constitution is also being affected. So both are responsible. So you have to take a conflict which is there in the mother and take into consideration the constitution which is developing the conflict. Then another type, that is hypergonadotropic, hypoestrogen anovulation, that is premature ovarian failure, where you see that AMH plays a very important role, right? The ovaries become hyperactive at that time, and because of hyperactive, they do not develop a mature ovarian failures. Like you have premature ovaries which are ovums which are being released, which do not have the capability to conceive and continue with the fertilization. Then there is another case, that is hyperprolactin. So in the higher centers of the hypothalamus-pituitary, you have so many cases where you find that the mother has got lot of prolactin, and therefore hyperprolactinemia leads to anovulation. What happens exactly in this case is that because lactation is something to be done after the birth of the child, lactation is giving nourishment to the born child. So mind is in the delusion that I already have a child whom I have to give nourishment. So I'm not prepared. पहले से बोलते थे कि till you are feeding the child, baby, you will not conceive because you have got lot of prolactin which prevents another child to conceive, so that the child who is in the hand of the mother is properly given nourishment. So this hyperprolactin is like the mother has got that insecurity, lot of insecurity, that fear of starvation will come over here, that insecurity that I have to give nourishment to the child. So all these are the seed conflict. Then ovaries are the identity of the female. Identity as a female. I am away. My body is structurally identical because of ovaries. I am a female. I can enjoy the femininity if my ovaries are in perfect balance. I can procreate and enjoy the motherhood only when the balance between my ovaries and hypothalamus is perfectly in balance. I have to stand as a support, as loving and caring to my family. This is what my ovaries tell me. I have to bind the whole family. I have to nurture my children. I have to give nourishment, and I am the most precious thing of the body, and therefore thing in the body. And therefore, whenever there are ovarian crises, please go and hunt for the rubrics of identity. Now, how to understand this identity? So, identity, right? So, ovaries में problems को हम समझते हैं. तो हमने क्या देखा कि एक problem थी जहाँ पे ovary, एक प्रॉब्लम थी जहां पे ओवरीज डेवलप हुई, कुछ प्रॉब्लम ऐसी थी जहां पे ओवरीज डेवलप हुई बट फर्टाइल जोन में नहीं गई क्योंकि दे बिकेम hyperactive or they went into ovarian failures. Now let us take one step by step. So what happens when the ovaries go into insecurity and what are the conflicts leading to insecurity? So rubrics, ovaries fail to mature, right? So actually the first thing comes to the mind is insecurity. यहाँ पे क्या होगा, यू विल फाइंड इन द हिस्ट्री बहुत सारे केसेस में आपको मिलेगा कि द ओवरीज, द पर्सन फील्स दैट आई एम टू small. If you have attended my PCOD lecture, you have seen that there was a case where the patient felt that she is too small, she is too inconfident and not ready to get out of the shell. So they feel that they are not ready to face the world, because the world around them is not good. The world around them is not being protected. So here you will feel that there are lot many conflicts in the family, especially the mother has to fight for her identity in the in-laws. She feels that she is being not protected by good people, husband is not supportive, in-laws are not giving the value to the mother. These history you will take. Okay, I feel that I am immature, I cannot handle any responsibility ahead. So I feel that outer world is not good for me, and if I come out, I will really get injured. And therefore, I want to lie down in this cocoon and I want to be safe and secure. And therefore, I surround myself with this whole cystic development or with a protection shield. Then there is a delusion in the mind that in nowadays, if you talk to a female, they would always say, "Ma'am, I'm still so small, I'm not yet prepared to take the responsibility of the family. So I feel that I'm not mature enough. I am still childish. I am still very incapable," right? So these are the words which will come up from the mother's side. Then I am immature to face the world because I feel lot of animosities inside. During the womb, I have seen my mother fighting the father, the in-laws. They were very attacking zone to my mother, and this motherhood was under lot of stress during pregnancy. You will see lot many histories like father was alcoholic, father had sexual assaults, the mother was never being asked for a permission or a consent for sex, and still she was being attacked, she was being beaten up, there was a lot of injustice in the society, and therefore there was so much of discrimination also, and there was a lot of pressure to give birth to a male child. And there she felt that in spite of doing so much, still I was not being appreciated or not being identified as a member of the family. You will see here that in spite of contributing so much, and still there is no value, right? So there is no value to the female. So you will see so many cases coming to you in your mind when you see these ovaries fail to mature. But still, I am a fighter. I have to fight this controversial state of my life, and I will perform my best, and I will not give away. If I am not protected, I will definitely not give up. Okay, so therefore I am a tough fighter. सो जब भी ओवरीज का फेलियर होगा तो आपको ये सब चीजें आइडेंटिफाई, आपको ये केसेस में यू विल गेट दीज कॉन्फ्लिक्ट्स विच आर डेफिनेटली present. Am I very clear? Because this is ovary, this is identity, this is insecurity. What happens when an ovarian follicle matures? Once the ovarian follicle mature, it has to leave the shell and go to the outer world, get prepared for fertilization, pass the fallopian tube, and then pass the outer world. So therefore, you will see lot of carbons and Calcarea group coming up when you talk about these cystic development. Why? Because Calcarea is a very strong group which wants to be in the shell, which wants to be protected. There is Baryta which is coming up in this group because they don't want to use their own head, because they know if I use my head, I won't be valued. So better to surrender as a female. I feel I am too weak, right? I am too fragile. Thuja also comes over here, right? So there are so many remedies which tells about that I am weak, I am fragile, I am incapable. So therefore, Calcareas, timid remedies will come over here when you talk about ovarian failures. Okay, am I very clear till here? Because this is a concept which we are developing, and then we will link it to the cases ahead. Any doubts? You can definitely ask me over here, because then we will go ahead with ovaries further. So I'm not ready to come out of my shell is definitely a conflict which a Calcarea will talk. You will hear from the couple saying कि मैम हम ही लोग ready नहीं, तो हम ही लोग prepared नहीं थे to get conceived, and we were never accepting the pregnancy. So they are that generation which did not want to conceive, and they have just rejected the opportunities of conception, and they have delayed it always, feeling that they are incapable of conceiving. So these are those cases of infertility. Then you have, can you now correlate what will be the causes or the pregnancy state for these ovarian conflicts? Can you label few conflicts which you have seen and recollect from your practice what cases you have seen of pregnancy crisis or infertility reasons? Can you label or just recollect the states which were there in the family background leading to ovarian problems? Some situation you can describe, you can put it in the chat box, let others also know. Yes. So responsibility coming prematurely. Yes. Identity conflicts. Yes. How identity? Can you give an example? Libertinism. Yes. How you will label all these things or describe it rather than putting just a rubric? Can you put the situation in short so that people also come to know how ovaries get affected? So cause is in the mother and before the pregnancy. If there is some ovarian conflict, the cause is not in the pregnancy. It is 3 months before the conception. Go and ask the history over there. What was the pressure the mother had? What was the pressure the femininity was going under through? Did they go into treatment? Was it a normal conception? Did the mother accept the pregnancy? Or the mother was not prepared to get pregnant? So what were the conflicts which were present as a feminine, right? So mother used to say that me and my, so if it is from the generations coming up, then also take rubrics like fortune ke rubrics. Take something related to very deep conflicts which have gone deeper into the value system and the belief system of the whole family, right? I have to take a lot of efforts. Yes, so many responsibilities coming up. So puberty and early childhood you need to explore. how this female was being handled in the society. Then you will see lot many cases who go into ovarian failures. You have so many sexual assaults which are coming up, and that sexual assault is from the family member themselves, and the femininity is being suppressed at this time, and the females are not ready to vocalize that yes, I was being protected by my father, or what was ultimately there ki please keep quiet and don't share this emotion with anyone, because I don't give a permission to you to fight back. Okay, so I just want you to keep quiet and just face everything. Don't share, because you will be humiliated. That fear of humiliation, that fear of losing the position in the society, all these will be coming up. You will be insulted. I don't allow you to share it to your family or friends. Keep quiet. Okay, so you cannot vocalize your problem. So this will lead, because during pubertal phase, when the femininity is developing, at that time you are being suppressed. Then even the queries come up ki ma'am, how to handle this child who has started with secondary sexual characters. Now how to make her explain that you are a female and your body changes, so there is embarrassment which is there. Okay, so this embarrassment is also syphilitic. So if they have body consciousness, they are, matlab, I had a mother with a child who had hyperpigmentation and dark complexion, whereas everyone in the family was fair and with good looks. And totally every time this female was being tortured by the mother, saying that you don't look good. How I think you are being exchanged. So there is rejection, right? There is neglection which is there in the family, in spite that mother knows this is my own child, but something has disrupted. This is also seen in cases of cases where they go into IVF, where the source of the sperm and the ovum are donated. So there is disruption. So they don't feel that they belong to the family. Okay. So there is like, I am not accepted in my whole family. I am being estranged. I feel embarrassed because I have to face the challenges of this life. Then abuse, that is what I said, ki you will see lot many abuse history, sexual abuse, ailments from abuse, sexual staphysagria is the one of the great remedies coming up over here, because in the childhood they have to face so many consequences, and these consequences they directly hit the femininity. Because of this abuse they start hating. There is misanthropy, the way they handle. They have that, you have seen in movies and in so many patients come to us ki for days together I just had that fear of my shadow also. So there is so much of shock. Okay, this shock will again affect the ovaries. Okay, then there is abuse in children. They do not even understand what is all going on with their body. Okay, so they don't even understand, is it a game which is being played with them, or actually they are being assaulted. So they have that deeper sense of fear of being touched, aversion to sex, aversion to intercourse. There is being forced intercourse like in abuse condition. So therefore they have hatred. They don't even, they have that aversion to touch also. Like they go into that fright stage even when touched. So you have so much of fright stage also which is coming up, and shock. They have that fear that because I am too weak, I am not being valued, so I cannot be independent. I don't want to be an independent woman who can go outside. So you have Barytas coming over here, you have Calcareas coming up. They are clinging to the mother, they are staying back to the family, and they don't want to overgrow themselves and go into the world because they have so much of fear, past memories. There is a beautiful rubric there that the bad stories affect profoundly, right? CPI is one of the remedy over there, because all the sad stories, bad events, they affect so profoundly because they have never come out of their past memories and they experience all the stress by themselves, facing it as if it was their own stress. So this is what happens when it comes to a state where ovaries fail. So they don't want to become individual. They are feel that I am still immature. So child, I am still like a child. I don't want to go to the outer world. So also because of all these assaults not being handled, then there is so much of discrimination between male and female. You will see ads coming up where they show that when it is a female child, she was never being served a glass of milk, and when it is male, you eat well, you are given all the food of preferences, and when it came to a female, she was always given the leftover food. She was demanded to take care of the family too early in the childhood, whereas the male is being pampered by the grandparents, and there was so much of discrimination that this child feels that no one is her own, even death of the family members. I had a case where both the parents died with very early age and she was left as an orphanage. Okay, so that deserted feeling, that orphan feeling, and therefore she was like, I had to become a prostitute or a polygamous because people started eating me like anything. I was like readily available on their plate. So therefore this sexual identity was being hit, and the feeling that I am being surrounded by the enemies, I feel so insecure that I just want to live a life in this shell. I don't want to get out of this. So you will see that ovaries fail to mature. She is being criticized. There is so much of injustice which is happening with her, and all these crises will lead to the conflict of the seed conflict in the mother or in the patient, and all these experiences of mother are being transformed during the womb to the child. Okay, is this very clear? Any doubt? Now you're able to correlate with your infertility cases. If you go back to their history, you will find all these conflicts coming up. You see AMH low, you will find in AMH low you have this LH high, increased testosterone levels, so lot of masculinity comes up. Okay, they want to behave like a male. We will take all that also, but this is for ovarian failures, why the ovaries fail to ovulate. Okay, why the ovum is not released out from that ovarian follicle. Okay, I am being mocked at, therefore I am being criticized. I told you, right? We have already discussed this. Okay, I am conscious about my own self. I cannot live a happy life independently because I am not having that confidence. So maximum low confidence remedies hitting the identity of survival. Ki I should have not existed on this world because I'm not being needed in this world. So therefore this comes up. There is so much of jealousy which comes up because of discrimination, and therefore the mother also feels ki there is sister-in-law in the family, co-sister in the family, they are being treated so well. And when she says ki I am pregnant, I also want to be a good daughter-in-law, but my mother-in-law never behaved well. So I was always in that phase of jealousy. So even remedies will come up here of jealousy, and who have got lot of domination in the world, and therefore they feel unprotected, surrounded by enemies. This is the mental state where ovaries get affected. So these ovaries, when they go and develop a ovum that is released in the fallopian tube, that is where a normal ovulation occurs. But if they do not mature, they become encysted, they get fluid filled, so lot of insecurities start developing, leading to PCOD. So PCOD I've talked so many times and you all know about PCOD. So in PCOD there is lot of anticipatory anxiety because we are talking about psychosis. See now, what is the difference between PCOD crisis and ovarian failure? If it comes to PCOD, still psychosis is there somewhere. In ovarian failures, it is primarily a syphilitic conflict because it is hitting the identity conflict. You will have identity crisis over there. So rubrics of identity will come up. But here in PCOD, there is a base of anxiety, a base of psychosis which is present in the cases, and therefore you will find in PCOD cases it will be related to insecurity and need of protection. I don't want to go to the outer world, and therefore I want to shell myself. I become resistant to the LH surge. I fail to respond to the FSH and LH hormone, and therefore my ovaries become very obstinate and they get insisted because I don't have the confidence that world is protected for me. I feel very insecure, and therefore I have lot of anxiety for the future, fear of facing the world, and I have bad childhood memories. So therefore in PCOD, please, if you take puberty, don't forget to take 8 to 9 years, 7 to 8 years का जो age group होता है ना, वो मत भूलना कभी, because that is where the exactly memories go deep down to your subconscious mind and how it was being handled. Maximum girls in India, you will see that they were being not handled by the male society with history of sexual abuses. So insecurity, what will be the rubrics for insecurity? Can you put up now insecurity ke rubrics which will lead to PCOD? Can you put insecurity, how insecurity will develop in a female? What will be the causes for insecurity? Like we had identity crisis, now we have insecurity crisis. Okay, so how insecurity will develop and what will be the rubrics for insecurity? So frequent quarrels in the family, the insecurity is because the environment is unprotected. There is alcoholic father, alcoholic male, and they don't have good secured life. So they want harmony in the family. They just hate the disharmony. They just want to avoid the conflicts, and they go into their own shell just to protect themselves from the animosity which they have in the society. They just develop hatred for the whole society, and therefore they just reject. They don't want to get married. They don't want to procreate. They enjoy to be aloof. They have despair. They have lot of sadness. They have lot of indifference also into them. So ailments from lot of insult, family discords, delusion of being neglected, delusion, despised, aversion to marriage. Therefore, they have lot of insecurity and they want to shell. They are having delusion of being neglected. Okay, so they don't want to come out. Now, the other rubrics of insecurity will be delusion neglected, delusion forsaken, hatred to persons who have offended, aversion to husband, aversion to marriage, delusion despise. So you have all this story which is there in so many cases where you will feel that along with infertility, the causes are like fibroids, uterine fibroids develop, PCOD is there. Then because they don't want to procreate, because they have so much of neglection and forsaken feeling, so they just reject the nature plans of conceiving and giving birth to the progeny, and they don't want because they don't feel secured in this world. So there is lot of psychosis which is present over there, and therefore because of psychosis you have so many cases coming up where you find all these rubrics can be taken up for the prescription also. So they have lot of bitterness inside. They have that feeling that they are not being taken care in a proper way. Okay. So when you talk about all these rubrics, so how you understand delusion neglected? So I told you that delusion neglected is like when you are not being taken, those efforts are not being taken up by the family of taking care in a proper way, and you are being abandoned. You are being, you are not being, what I should say, forsaken feeling. You are not being valued. There is a difference between neglection and forsaken again. In neglection, there is a part of ego which will come up, that I am not being valued. I play such an important role in the family, still I am not being valued. Whereas when it comes to forsaken, I am not being loved in spite of giving so much care. So here one is related to ego, the other is related to the love feeling. In spite of giving so much, doctor, I loved my siblings so much. I never discriminated between my sister-in-law. I used to give everything what was belonging to me. And still, whenever I used to go downstairs, I would find ki as soon as I would go, they would just keep quiet or they will not involve me into any family issues or family matters. So this is neglection and forsaken. Okay. Then hatred to persons, because I hate these conflicts. I have never got a good image of a male in my family, and all these family members have been already brutally handling me. So I have hatred and I cannot actually forgive the people who have offended me, and I hold those grudges inside me. And one of the remedy over here is Calcarea self, because they have got non-healing of wound. So if you have non-healing of wound, delayed healing, so you will see these people have got lot of hatred where they do not forgive the person, and therefore that wound never heals. The wound actually doesn't heal in the heart, and it doesn't heal in the body also. And because I have never been valued, and I am being brought to the family because of this husband, because of this marriage, and I see that my mother was never happy with this husband. So I don't want a husband or relationship in this society. And therefore, you see lot many living in relationships coming up, and where the patient doesn't want to get married because they don't want to go into that commitment of marriage because they cannot trust others. So when it comes to despise, you have to understand how this despise is to be taken forward, because in despise there is worthless feeling. Doomed is like कि मेरा पूरा जिंदगी अंधकार में हो गया. But in despise it is like कि you are being disliked for something. मतलब तुम अपने घर से for dowry issues you are being tortured. You are tortured for not looking good. You are being tortured for not having good figure. You are tortured not being able to handle the daily course well, and therefore you feel that these people are tormenting you. And when this tormenting feeling goes to the level of delusion, take it as delusion despised. Okay? Because there is an equivalent feeling of being hatred, looked down, being rejected, and being also worthless. Then it is delusion despised. I hope this is very clear and you are able to understand how we are connecting to the conflicts. Because I had so many cases, it was really very difficult. So I had to summarize maximum experiences which I had through the practice which we have. Yeah. So this is insecurity. Even if you have recurrent abortions, as Dr. Vishali is being asking, abortions, friends, this is really very important, because even recurrent abortion, there can be so many causes. If it is third month, then torch is one of the major reason, which we will take it later on in the next slides in the lecture ahead only. So please just have that patience, and we will definitely understand, try to correlate everything connected. Okay? So delusion despised, is it very clear? Okay, now I don't want to get matured. Okay, now the ovarian follicle is there that I want to get released, but I am premature enough not to come to the society, right? So how will be the rubrics over here? What will be rubrics related to? See, we had identity, then we had insecurity, now we have maturity. So what will be the rubrics for immaturity? So you have females who feel, they tell you, right? Ki, ma'am, I don't want to get pregnant because I don't feel I am quite grown up. I feel I am still not developed enough. We have not got financial security for the future. I want to earn good. I want to give best to my child. I don't want to get the struggle what I had in my childhood. So I don't want to give this struggle to my child. So I want to get quite stable before I give birth to the child. So what will be the rubrics over here? So there is insecurity for the future. There will be, can you label now what will be maturity rubrics? Can you guess? Maturity rubrics, you can come over here. I've already taken few of them before. So related to maturity, precocity will also come over here, because I feel as a child, they go into early puberty, right? Early puberty will also affect the ovarian cycle, because their body was not prepared enough and still they went into precocious puberty, hampering the fertility. Yes, early responsibility anxiety of the future, anticipatory anxiety for the future, anxiety about the responsibility I have in my family. I cannot be independent. I don't want to mature because I still want to cling to my family members. I want to cling to my parents. I had a case over here where I had prescribed natrum car, okay, where the person would always say ki I never wanted to mature, but the lady was very conscientious and very diligent. But when it always came to marriage issues, she would always say ki I never wanted to leave my home and go away. I never, because I was so much attached to my family, to my room, that I never felt like I should leave this home and go to the outer world. So this is also clinging, okay? Helplessness. My situation of life was such I never realized also कि I aged so much, right? When did I mature? I also did not realize the whole family situation was so much that my father died. My siblings were too small, they were too young, so I had to take their responsibility early. And the situation was like my self, I ignored and neglected myself, and I had to fight back to the situation, and I had to surrender myself to the whole situation of the life. And this is helplessness, also a maturity rubric. Then confidence lack of, yes, because of insecurity, because of independence, I do not trust others. I cannot trust a male. I cannot trust a marriage. I cannot trust what I should say. I cannot trust anyone. So this is not confidence lack of only with me, but it is also confidence lack of with the whole society and the marital. मतलब there are so many people who just argue कि मैम ये क्या कोई system है? I can consequences of the marriage. They are so timid. Want to face this world. I never wanted to get married because I don't have the courage to face the world. So you have remedies which are like कि even lycopodium coming up over here because they are covers. Lycopodium is also very good remedy for infertility, especially in males sterility. You will see lycopodium which has beautifully acted on the sperm counts level. So cowardice becomes a very important. It is a psychosyphilitic rubric, but it can be taken syphilitic if it goes overpowering the intellect of the person, saying that yes, I cannot trust others, and I feel that people are not very much stable outside world, and I don't want to come out. Okay. So responsibility aversion is also another wonderful rubric which can be taken in infertility cases, where you will see that they have so many responsibility related things and issues, where medorinum, lycopodium, phosphorus, they are the remedies which are there for responsibility aversion, where they feel that I am not capable of taking over the responsibility. Phos is still feels like a child. I don't want to take up the responsibility because of cowardishness. Lycopodium doesn't want to take the responsibility, and Meadow has got its own delusions that still I am too small enough and I don't want, I'm incapable of taking the responsibility. So in irresponsible behavior. Then body parts, head belong to others. This is also very important rubric where I don't want to get mature. Like Baryta and Calcarea. Baryta is foolishly audacious. Calcarea is completely dependent. They all are clinging remedies. You have even in clinging, the remedies like borax is there, stramonium is there. So they are like they don't want to use their head, right? This is where they feel what I should say, they don't want to use their head because they are being so much dominated in the female as a female in the society, that they have that fear ki if I use my head. There was a very beautiful case in the camp where we took the history, and where the mother said ki because I was a working woman, I was working in a college, and therefore I never got the opportunity to learn the house chores. I never learned how to go for cooking. And whenever I went after marriage, I surrendered in front of my mother-in-law ki rather than going into conflicts, better to do whatever she says. So when I was at workplace, I would always be a very dominating, a very sincere lady. But when it came to the home, I never wanted the conflict. So I surrendered whatever my mother-in-law demanded. And therefore, I would always accept whatever she was saying. Without putting my head, I would just say ki yes, it is right. Whatever you say, it is right. And I just surrendered ki saying कि बेटर है मैं वही फॉलो करूंगी और मैं वही सुनूंगी. द रेमेडी विच वॉज प्रिस्क्राइब्ड इन दैट केस वॉज कैनबिस. Definitely domination is also, therefore in domination only this it belongs to other at the syphilitic level came up. Okay, so fear of labor pain is also fear of injury, right? I had a friend who would always say ki I love children, but I never want to be a mother because that fear of passing that child from that canal is so shocking. She would faint in the labor room because she could not tolerate that pain. So it is fear of shock, it is fear of pain. She did not have that pain endurance. So sensitivity to the pain also is also important thing which will come up here as a part of fear of injury. Okay, so even time passes slowly. The person would say, come here and tell you कि I don't feel कि I am, मैम बहुत टाइम बाद सिर्फ 24 ही साल की हूँ, 35 में भी तो शादी होते हैं. दे कीप एन आर्ग्यूइंग कि 40 में भी तो फला फला को शादी हुई एंड दे कंसीव. मैम अब तो ओवरीज फ्रीज करने लगे हैं, तो आई विल फ्रीज माई ओवम एंड कीप सो दैट इन फ्यूचर इफ आई वांट टू हैव सरोगेसी. So these are the patients who will tell you with all n number of reasons that they have sufficient time in their life and they feel that time is passing slowly in their life and still they are too young to get married. They are too young to get conceived. They will always tell you that they are not prepared for getting married because their time is stuck up. They have not progressed what they demanded in their life. So this can also be taken as time passes slowly. Now, maturity, again, when you talk about maturity, they feel that they are not protected, they are away from the home. Ma'am, we are in certain place where there is no family member. I had a case where they stay in USA, okay? So they say ki I don't want to get conceived because I know ki there will be no one who will come from my home, from my family to take care of me. So I always pressurize my mother ki if you want to become a nanny, better you come down here and support me so that I am able to conceive well. So they have that delusion that they are not in protected place, in-laws place. They feel that it is not their own family. They are not being accepted in the family. That is also. So they are surrounded by strangers. So they feel unprotected, insecure, delusion of being persecuted, being tortured and tormented. They have a feeling that yes, this delusion wrong done. I will tell you. In one of the case, what has happened is ki it was a love marriage. Okay, so in love marriage, what happened is ki they went into pre-marital contacts and by flaw they conceived and she aborted. Okay, because they were not prepared to get married because they felt that they were too premature to handle everything and it just went into a flow and she forgot to take IPIL or she just was not able to adapt to the situation and then she went into that guilt. My God, I have done something crime, I have done something wrong and because of which I am being punished. I am being criticized. I have to face the consequences because I know I am a crime. Yes, this is the feeling which was there. And as a consequences, you will see that they go into infertility. Even they carry the guilt of the past consequences. If they had some extramarital affairs, they had some affair with multiple partners, and they have that fear that what if my secret is being revealed? This person will torture me. This person will just throw away my dignity and I will be definitely not good. So if there is a lot of domination, you are being discouraged, you don't want to be, you are being criticized for so many things, so you get discouraged easily. So therefore of discouragement also, you don't want to grow up because, are kaun karega? Again, if I do some step ahead, I will be criticized and I have to get back. So better not to go ahead. I am discontented with whatever I have in my hand, my family situation, my life situation. I am discontented with the family situation, so I'm not prepared to go ahead and take up the risk of getting married. Or I am like, ma'am, I wanted to have payment in six figures, payment in six figures. Right now, I am in five figures, so better I should have a good wealth in future so that I can conceive. Yes, it can be. I didn't take care and got aborted. See, in this delusion wrong done, there has to be a guilt. You cannot take just because there was an abortion. There has to be a delusion wrong done is like ki, they know that they are guilty of that crime, that anxiety, conscience pinches them. Their own thought process that yes, I'm wrong pinches them. Then they feel that I am alone, I am being orphaned, I am being left alone in the society, therefore I don't want to mature. Because if I grow over, I will have to take up the responsibilities. And I am a person who don't want to be left alone. I have fear when I'm being left alone. All those fearful thoughts of the memories of the past, they haunt me. So better I want company. And when it is a company, I don't want a male company. I just cannot have that thought because whenever I was alone, someone would just come and have a bad touch, or I always felt insecure when I was alone. So that fear of loneliness takes the patient into that shell back again and not ready to come out to face the world. So there is a fear, a disaster can happen. A fear, something bad. Stramonium comes over here. A beautiful remedy for PCOD where I really got good results, where there was a shock in the past, bad touch in the past, there was something which was very fearful, and then the person goes into startling and all bad memories. Even Kali Brome is very beautiful remedy over here because they have got so many delusions which come over here. Okay. Then fear of poverty. Yes. Ma'am, you know what crises are going on. There is so much of insecurity which is going on. And we know that we have gone back. Every day we are fighting that struggle ki tomorrow we may be removed from this company. So where we will go? And in this poor situation, tomorrow if I don't have money, they are avarice. Where will I feed my child? So there is fear of starvation, there is fear of poverty, and therefore they don't want to mature. So I think this maturity is very clear how we develop the whole concept, the rubrics which are there as a story part of experiences we have in day-to-day life. The family crisis, yes, in if I will say, if you're talking about delusion wrong done, delusion criminal, yes, it has to be guilty ki whatever they have done is wrong. That guilt conscience should be there. If they don't have guilt conscience, don't take delusion wrong done. Now come to the identity. As we said, ki ovaries, they fight for the identity and they give you that dignity in the society, that recognition in the society. So if you see that identity crisis, so we have seen ovarian failures, which is hampering the identity of the female as born as a female. So can you give me few rubrics, very quick rubric of identity crisis or related to identity? Giving me identity rubrics where identity is at stake. Libertinism is not only identity, identity related crisis, identity errors of personal, yes, definitely confusion, identity of delusion, personal identity, error of, then more rubrics related to identity. I hope you all are enjoying this session because this was very lively and I'm trying to put all the things proactively. Yes, duality sensation of head belongs to other. Yes, it is also an identity rubric which will hit identity of a female, mannish habits, effeminity. Yes, they all are identity rubrics which can be taken up if you see ovarian conflicts, right? If you see Klinefelter syndrome coming to you, Turner syndrome coming to you, directly take these rubrics because they are hitting the identity. You see lesbians coming, gays coming, take it as the identity crisis because they have developed that identity crisis. They don't want to accept themselves as a female, and therefore here even the rubric of head belongs to others will come. So confusion identity to his. Okay. I took this rubric directly where I had a case where there is ovarian dysgenesis, or sorry, hypogonadism was there. So this was already taken. Then confusion identity to his duality. This can be taken up when a managed female comes to you. Okay. Where she wants to behave like, ma'am, I am a female, but the body says ki I am a male. So PCOD also, if it is very stubborn, hirsutism, if hirsutism is very strongly there, please you can take this rubric, because hirsutism is again strong character of character. Okay, where the look is mannish. Okay, so more than mannish, you can take this rubric of confusion identity, because they are all going to the level of cell, going very deeper, very syphilitic rubrics. Delusion, identity, errors of personal. Yes, this is also personal identity crisis, where I am confused ki what I am. Am I a female? Am I ready to be a mother? Am I ready to be a wife? Or I have to play the role as a male, taking up responsibility and fighting it. So antagonism with herself. I recently used this rubric in few cases and wonderful results, friend, because antagonism herself with is when you said there is a situation. See, it is not only fighting with the identity, but what I demanded. I took this rubric in one of the case where she said, since childhood, I dreamed of something which was very beautiful. I dreamed that I would work hard. I would become a good entrepreneur, or I will settle well because I am very intelligent. I took all the responsibilities where I wanted to shape my life as a successful individual. But after marriage, ma'am, everything has shattered. All my dreams have shattered. I don't see any future, because this is where I had to surrender myself, because I have to yield so much to my husband or to the family situation. Like this case I took when the lady went to US, and there she could not practice because they did not have that visa to practice, and therefore she said ki I was trapped inside this home and I lost everything. In a day I was standing nowhere, and there I was struggling, fighting with my own self and searching my own self. So rather than taking delusion identity person, take antagonism with herself, because the whole life is just what we say now, वो 360-degree round up हो गई. Whatever we have dreamed, whatever I have taken the efforts, all is fruitless, and everything is just antagonistic to what I have thought about my life. So all the dreams what I had, the life, the reality of life is totally different, which is really very difficult to accept. So that is antagonism with herself, can be also taken as a rubric of identity, because I'm fighting with my own self. I have really shaped my future. Managed habits or effeminate, that you all know very well. Aversion to opposite sex. So that is what we can take when it comes to identity crisis, when it comes to non-productive sexual activities, having attachment to your own sex and hating your opposite sex, right? So this is also destructive and very much against the mother nature. Okay, so identity rubrics, again you will find, see, that was complete syphilis. Okay, then psychosis, how this identity creeps inside and really disrupts everything. So too much of, in today's world, what is happening is we are losing the, if you remember that slide of masculine energy and the feminine energy, right? So we are losing this feminine energy because we are becoming too ambitious. We want to prove ourselves. We want to compete with the male. So we have become too ambitious. Okay. Ambitious increased by any means. Viratram is a remedy which is over there. Okay, because Viratram is like you want to achieve so much of luxury in life, so much of materialistic things in the life, that they lack that love. They go into OCD, they go into mania, right? Because they just want all materialistic needs in to be satisfied in the life, and they leave the nature's purpose for what you are born with. Okay, so if you find a too ambitious girl who is fighting for herself and getting effeminate, please think she can be obsessed with her. This is obsession, right? This is obsession to her status. This is obsession to the luxurious life they want around. So that is much ambitious. Fame for, you can think of lachesis, you have Naxwamika in it, but every means employed, you have Platina, because in front you have the movie Ladla. Okay, in front of her, she doesn't take care of anything. She becomes so haughty, so ambitious, so intensified self ego that she forgets what they are born for, what purpose. So, even ambitiousness, if too much, can be taken up as an identity rubric. And I have used this for prescription. Too bold and too courageous. This is against the feminine characteristic, okay? Audacious, too adventurous is all against the mother nature. So this is also something against the femininity. Independent. I want to be ambitious. I don't want to be into a family. I don't want to go into bondages where I'm dependent emotionally also. I am a strong woman of this world where I know how to handle myself. Please don't teach me anything. You don't have that any right to bind me to any obligations of this family. Okay, so without marriage, if you want to enjoy the life, live with me. Otherwise, I don't want any bindings. So, too much of dominating and dogmatic characteristic is also there. So, dogmation and dominating rubric will also come over here. Okay, so body, definitely head belongs to other is another rubric of identity. Delusion enlarged is, right? So, heightened ego, I said, right? Platina doesn't take heck. Platina is a beautiful remedy if you see for infertility, because platina has got that feeling that no one can satisfy me. It is a beautiful remedy for nymphomania, because they never get satisfied for whatever they have in their life, right? So they have that blighted ego not being settled, and their self image is very different than the reality, and everything is destroyed behind that image of their self identity, where they lose that what the reality is and what they are. Okay, libertinism, yes, will come over here down the line, because they want lot of freedom. I want freedom to live. I want freedom to free will. I want to plan everything. I don't give right to my father to select the partner. When I feel, I will select a partner. I don't want responsibilities. I want just freedom to live this life freely. Is another libertinism, is another a rubric of identity, of course, rather than maturity, because it fights with the actual seed hindering the capability of a female to procreate. Okay, so because getting binded to motherhood, I don't want to take care of the child. I had a case of libertinism, I will tell you. This was a very beautiful case. It was about a lady, and she said, what, the words were like, कि ma'am, मैम ये बच्चा हो गया, I don't understand what is to be done. I तो thought कि everyone is poking me and everyone is poking me to have a child. So what I did is कि I conceived and I brought this child to the world, and बस मेरा काम हो गया, giving birth. I did not want to feed the child because I did not want my figure to be disrupted. So I thought was कि बच्चे को पैदा कर देंगे and I will hand over this child to the mother who will take care of the child. I don't want to take this responsibility coming to me, and I don't want to feed the child. So there is no lactation which is coming up. So this libertinism will also come over there, where the mother want no bondages, no bindings, and a relationship also. So libertinism can be taken as a very bigger aspect of rubric, where freedom of free will becomes more important than other qualities of love, care, and affection. Okay, I hope this is very clear. Any doubt how we are deciphering libertinism? Can you understand? Okay. So injustice cannot support. I am a free lady. I am an independent woman. How dare you discriminate between me and a male? I'm not less than a female. I am taking all the responsibility. You should give me respect, and I'm fighting for everything. So they become blind and they cannot tolerate a single thing. They become so contradictory. They cannot tolerate any will contradiction also over here, because they are becoming contrary. They become just contrary, and they cannot take up that sexual discrimination between the society and the family. Okay, so that indifference comes up, and therefore I become indifferent to my own identity, indifferent to the most important things of survival. I become indifferent to happiness. I become indifferent to my own family, indifference to my own children, indifference to my loved ones. So I just give more importance to materialistic plane rather than giving love and affection. This is also indifference. Okay. So identity rubric, as I already told, ki platina is one of the beautiful remedy which is coming up for identity. So there is antagonism because I am fighting with my own identity. Delusion, criminal she is, that I lose, I am boasting, I have that guilt inside me, and to just cover that guilt, I have that feeling that I have done wrong, so I have to be punished for everything. Crime committed, she has unfeeling, hard-hearted feeling of being soft with others and hard on inferiors, that we have already taken. Then aversion to children, aversion to her own family, aversion, touched aversion is also a rubric which is against, because a female wants care, love, handling, and when it comes to aversion to be cared, aversion to being carried, aversion to be touched is also syphilitic, leading to fight against the identity crisis. So they don't want contradiction, they are very haughty, they have will contradiction. Like if you say you don't have to do this, they will do whatever they want to, and they will stand against. They are the females, like unko bolo ki this is what a boy is allowed to do and a girl is not allowed to do. This lady will go and do what the boy will do, and they will tell you ki how dare you do this, because they are so obstinate, they are so pertinacity is there in them, that they don't want to listen to any society disciplines or society rules, and they disobey and they are disobedient because they don't know the resolution, they don't know the decision they have to make at the right time and right moment as the role of female. So they don't want to decide in their life what is to be done, what is right and what is wrong, as per the age, as per the situation, as per the society belief system. So they just want to fight, they want to disobey everything. So they are anarchists. You have remedies like Merck. So they are so corrosive that they even destroy themselves. They fight themselves. The whole family is just shattered because they just don't want to obey any rule being laid down in the family, and they just don't want to follow anything which is being there for the harmony, and they are so revolutionary people, right? If a female is said not to participate in certain thing because you will lose that delicacy, they will go and participate in the things which are very dangerous and against them, which will even affect their female genital system and affect their growth. So they are very audacious, courageous. That is what I said. It is against the quality of femininity. They are delusion being doomed. They say that you feel that I am unfortunate enough. I feel unfortunate enough. My whole life is like what I had planned. That is antagonism, what I explained, right? I had a plan in my life of becoming a successful person. And what has happened now is that I am losing the whole dignity. No one is respecting me. No one is giving me any, and I feel everything is dark in my world. Everything is misfortune in my love, and nothing is working according to me. So they feel unfortunate, they feel doomed. So they all will create all the crises of identity. Now, these were the short rubrics. I would like to take one more reason because torch was being asked by someone ki ma'am, how to take torch and what are the significance of torch, and the case which I'm going to present is also having a crisis because of torch. So that is one of the reason. Till here, it was the rubric and emotional pathology getting connected to the physical play and how infertility develops through the evolutionary part till now. I think it was not very complicated, very easy language and can be interpreted in daily day practice. And so many cases must have come to your thought process ki yes, this was there, this I saw, this would happen when we used to meet sir and he would teach us. So many things would come to us ki yes, this is what he wanted to say. Okay. So when you talk about torch, what is torch is toxo. It's a mixed viral infection. It's a whole group of diseases which are affecting the fertility of a female, even in the intranatal life and the prenatal life. If it is prenatal, it leads to frequent abortions, that is premature abortions in the third month. And if it is in the intranatal life, it is very dangerous, giving lot of congenital anomalies to the child. So in our CAM cases, we see so many cases where the torch positive mother just conceived and the infection was not checked in, and they have so many diseases. Especially we have deaf and dumb cases, the measles goes, you have meningitis, you have congenital disorders, congenital anomalies, many congenital anomalies developing because of this virus. And as we all know, these viral infections, as sir would always say, they are nothing but viruses are the fragments of the DNA, right? So RNA virus is also a fragment and DNA virus is also a fragment. So they take your own blood, they take your own genetic material, they just replicate inside the body and they turn over the whole system, I should say, and something goes away from the future plan. So in torch test, if you see, there is T is for toxoplasmosis. Other infections like herpes is there, herpes simplex, herpes zoster. Then R is for rubella, leading to meningitis. Then C is cytomegalovirus and herpes simplex. So you have so many infections, even tuberculosis will come into other infections. So this is a whole plot of infections which affect the mother maternity issues. So toxoplasmosis, as we know, it is very dangerous. It can cause autoimmunity. Rubella is tend to have affinity to affect your nervous system, leading to jerks and paralysis followed by destruction. So rubella can be very destructive because it affects the nervous system and leading to destruction of the nerves. Whereas herpes is a very superficial cystic like swelling blisters it will cause, and it has a virus which has got a tendency to develop tumors. But when it comes to cytomegalovirus, it is really very dangerous. And when I was reading through all these systems, we came to know that cytomegalovirus, once it infects, the mother can stay back for the lifeline. So how it can stay back into the body for the lifetime is because of the destruction of the genetic code. It can occur because it is very dangerous. It can lead to destruction of the marrow also. Maximum cases of deaf and dumb, they have got destruction of the whole ear mechanism because of cytomegalovirus, and it can also bring up blindness also. So cytomegalovirus is very dangerous. And yes, so this is about torch. Then there is torch there is one thing which is kept to be important is ki they have frequent history of abortion. So someone asked me that what is the cause of frequent abortions in the third month or in the first trimester. So don't forget of taking the torch history. So connecting this whole thing to the case. So this is case number 1. She came to me with secondary infertility. See how they play a role in history. They deceive us while giving the history. So you will find it that when I was taking the obstetric history, she said ki it is second 2 times I have been pregnant and I don't have an alive child because I have a frequent abortion history. One is MTP done and one was IUI with failed to develop, and therefore I have no alive child and I'm desperate to have a baby. Doctor, can you help me? I always had a complaint because of frequent cervical infections which were there. So frequently pap smear is being done. And every time this pap smear said that there is infection, severe candidiasis which is present, and even infective foci which has always been there. So therefore the cervical discharges are offensive. And also I have this severe pain during intercourse, and my husband feels that I have no interest in him because he doesn't look good, and therefore I have so much of pain and dryness of vagina because he feels that emotionally I am not vibrating to him and not supporting him. I also have hypothyroidism, which I'm suffering since 4 years. I'm already on 75 mg of Thyrox. So she also has hypothyroidism, and if you will see her history, you find that LH and prolactin level is high. Sorry, prolactin is good, but her pap smear shows severe candidiasis, and even sonography shows that there is symptoms of endometritis. So there is lot of inflammation with growth also. And the torch test which was done by me, because she had frequent abortions, and when I came to the history I found out that I'll share it in the YouTube so you can take it again. So torch positive was done by me, and I found out to be that IgG was very positive and very high. That was the titer was 150. Okay, so now we have to hunt for the cause and effect correlation in the whole history. So here we have 4 things to be understood, 5 things to be understood, that there is some uterine problem. So there is a structure which is being affected. So there is a fibroid, there is a soil issue which is endometrium, there is infection at the cervix also. So there is soil which is actually the problem with previous history of abortion, and the environment which is playing an interrole. Now here, as we see that the ovaries are still good, only thing we have to search is because there is lot of infection, inflammation which is there. So there has to be lot of anger which we have to hunt in the whole case. Okay. So when you talk about anger, we have to hunt where this inflammation and infection, because itis is present. So from where this anger has to be there. Now, as I've already said, there is overgrowth in the form of fibroids, there is inflammation, but more destructive is what? More syphilitic. You have to take the higher myism. When there are few things which are coming, take the highest myism which is there, so which is more destructive. So torch infections are more destructive and more syphilitic. So you have to touch this syphilitic zone which is there in the patient and try to hunt the syphilis in the case. So I'm reading the whole life's history. Please prepare the totality and hunt where the cause of the disease is. So she is a lady who is 33 years, who was brought to me, and she said ki I belong to a very small town, and I am also belonging to not a very affluent society. So we had lot of struggle in the early childhood, and there was lot of family issues. Parents had love marriage, and because of love marriage, I was like, okay, fine. The environment was okay, but father was always like he forcing my mother to conceive, and always forced that mother should have the first male child. Okay, but then mother said ki I never took that pressure on my head, and I was happy with whatever I was having as a child. So, because we were belonging to a small town with poor education facilities, so we were shifted to Mama house, where Mommy was not good with us. The behavior was not good. The protection environment, which could have been there with my family, was not present. So, there were very frequent fights between my parents. So, always these conflicts would hit us, and father had always been a very strict environment. He would not allow us even to go and play outside or do something which was being allowed. So whatever was done at our family, and I was forced to stay back at home. But I was attached there, and I was like, I was always being discriminated also. What she said, ki my younger sister and I already had shared the same month of my birthday, but my sister got new clothes and I was always in a compromised state. And therefore, I had always been sharing my belongings and I never feel free to share my emotions. I had to always suppress it because in my family there was no one with whom I could share and freely talk. And every time I still remember that my parents would fight, quarrel, and create a scene which would always disturb me a lot. Still, father would love me, pamper me, and was good. But I remember my dadi would always poke my father for a male child, but I never saw my mother retaliating back. So there was comparison always with my brother and other siblings. I was not a child who would give up. I was very irritated and very obstinate and determined to whatever I wanted, whatever the situation is, but wanted to fight it. And I would never judge the situation. Whatever was going, I would never even realize ki what went wrong and why these people are suddenly started fighting. And there was always a fear situation in my life. I never had a good memory because I had no interest in studies at that time. I was being pushed for the studies and education, but because of the family disputes and the family situation, I never got an interest into mathematics, which was not so good with me, and never had good memory for memorizing all the poems and things. So I was very introvert, reserved personality. We went to a hostel and with my family, but there also I never took an interest. I liked playing and enjoying my life, but I never got that opportunity also because the life was really very difficult and I hesitated talking. Then she said ki I also went for a love marriage. That was my father's choice and I supported. I forced, that was not my father's choice, but as a father, I forced him to get me married to this boy. And after my younger sister's marriage, I got married. My husband is good. He is also very angry and irritable, but a very extrovert personality, but not so good looking. So he always feels that whatever relationship issues I have with him is because he feels that I judge his looks and I don't accept him. But that is not true. And I am also a person who is always been irritable and dissatisfied with my own self. So I was never satisfied with whatever situation and I always wanted to improve. And therefore, I always controlled my own anger and I wanted that no one should oppose me because I am a person who is very sensitive to criticism. And these conflicts, I would get angry upon my husband and just throw my anger. I would cry and not even talk for 2 3 weeks. Here, then she revealed that already before marriage, because it was a love marriage, that she did not give in the gynec history. What she said is that before marriage, we had illegitimate children. So, therefore, I aborted 2 times. The second one really became complicated and I was really very scared because I had to undergo MTP process and this was like a feeling which I still carry into my heart that I am being punished for what deeds I did in the past. And therefore, I really feel that I have done something so gross in my past that I don't like now touch of my husband even because somewhere I thought ki if it touches me I will really get pregnant. So I am so angry person now ki I cannot tolerate his contradiction anyhow. Therefore, these abortions and all the situations which are done by us in the past are reciprocating today, our future, and I'm being punished for whatever deeds I have committed. And I'm very sure, doctor, ki I really go to the temple and pray to God that please forgive me. I have forgiven my father for being discriminating and everything that doesn't hit my head. But this hits me that when I see my sister children, I just take them close to me and I pray to them ki I love you so much, so why can't I have a child in my life? And that anger is still there in my memory, and I frequently weep for it, and after some time I become so sad and depressed that I don't want to talk to anyone, even to my husband I don't want to talk. I am like not so much satisfied with my family and career situation because I'm not so practicing. So I feel that since I did not practice in my past, I did not give 100% to my career, therefore I'm not successful even today. And she always say that I have been comparing myself and always have that guilt and anger towards myself ki why did I abort, why did I refuse that pregnancy, why did I reject that child, and therefore the God is not giving me a child. I keep blaming self, and as a husband's reports, they always come normal. So all the blame comes on my head. The in-laws are not forcing me for my pregnancy, but husband is very supportive, but that guilt is still there inside my heart, and I cannot really forgive myself from that guilt. I have been doing so much to my in-laws. I have been bridging myself between the in-laws and the in-laws, and my husband doesn't talk to them or doesn't care for them. But when my mother-in-law got operated, cataract was being operated, I took all the care and all the efforts of taking love, of giving love and care, and still whenever it comes to appreciation, she never appreciates me for whatever things have been done, and I keep fighting and arguing and blaming, and I cannot keep quiet. I keep regretting of all the fights and arguments which have been there, and I blame myself ki I should have explained myself to my mother. Then anxious, irritable, and attached to the children. As a person, when we took the history, we saw that the mother also said, he see the whole analysis is here, and in the pregnancy history, where is the pregnancy history? Yeah, here we also took the pregnancy history. She said that she is irritable. Now you will see that why this lady went into abortion. Yes, there is self-reproach that we should have not committed this crime, or there is a forsaken feeling, that emotions, that aversion to study. She's non-diligent, she's ambitious, and she has that sin ka whole pressure. But if you go and see when she was a healthy lady, what was the family situation is that she did not wanted to take up the responsibilities, and what has affected her whole family situation is that infection which is there. So she is having jealousy also, she has an introvert also. Please, can you come up with the rubrics over here? There is infertility, there is failure to conception, there is repeated abortion, few are MTP done. So the gynec history which was presented before was misleading. During the history process, we came to know she is an introvert, she is dissatisfied with the situation, and so many situations are there. So your analysis is that delusion forsaken, suppressed emotions, and aversion. Yes, dyspareunia, that is there. Delusion, crime committed, unpardonable sin. Yes, that is also a beautiful rubric. Delusion, crime committed. Yes, and I have taken that rubric for the prescription. Reproaching herself. Yes, it is a rubric to be taken up because it is pointing towards herself, and because of that reproaching herself, she has that guilt into her mind. And I will tell you, when it comes to a torch like infections, the cytomegalovirus has got the capacity to be there and more syphilitic. So that was not allowing her to conceive further. Then later on, she said, ki, ma'am, I really aborted, and that abortions are very painful and really very bad odor used to come. So all these things, when you club it, you see that lot of nosodes will come up when it comes to torch positive. Try to understand medorinum, puja, and drugs will come up like syphilinum will also come over here because they are very syphilitic. Think of nosodes, think of non-conscientious remedies also, because when it comes to herpetic or sexually transferred diseases, they are morally not good. So just take it as a pocket that you can think of these drug groups. So when I analyze this case, sorry, it has directly popped up, but definitely the rubrics they say is reproaching herself, and because of the past memories what she has developed aversion of being touched. So that is also against the femininity. Then abortion and miscarriages, and that delusion that I have taken this abortion ka rubric is that abortion miscarriage tendency to, because she has a frequent history of abortion. This is a soil right now. There is no identity crisis over here. You see, the ovaries are functioning very well. So we don't have to take identity. We have to search for anger over here. Okay, so anger related rubrics are touch aversion. Anger and hatred rubric are reproaching himself, committed as a crime can be taken up. Delusion as if they are very reproaching himself is also a gun pointing towards self. And friends, here I will tell you, I really like sharing the reality what I did and what thought process went inside me. I have taken this rubric of delusion crime committed, but in that delusion of crime committed, I found out yes, delusion wrong done can be also taken up because she is following the repercussions, that misfortune which has been there into her life because of all the previous incidences of her life. But at that time when I was repertorizing, this was the true repertory sheet which I have taken up, and here I picked up the remedy. Can anyone come up with the remedy over here? Normally the patient, she's thirstless and hot. Yes, now get to the repertorial totality and try to understand the rubrics which are coming up and the remedies coming up. Can it be a viratrum? Is she so haughty with those feelings of so much of haughtiness or that mania? No, viratrum is ruled out. Sulfur, she's hot and thirstless, but she's not an extrovert like like sulfur. She's not that extravagant like sulfur. She's hot, so Cilicia is ruled out. She's not that diligent, not that anxious, low confident like Cilicia. Plumbum is another a remedy which will affect the recurrent abortion tendencies, but plumbum is also a metal. Definitely the metal qualities are lacking in her, and plumbum is also a non-conscientious metal, you know. All the other metals are conscientious, but plumbum is a non-conscientious metal. Merc, yes, merc can be so much destructive with offensive discharges, with anger, hatred, giving up that anger, and irritability of merc can be there. So we have the qualities of merc. We have even lycopodium, but lycopodium is timid, forward, with soft on inferior, with hard on, with soft of superior and hard on inferiors, which is lacking. And definitely we rule out Ignatia because she's not ever diligent and conscientious. So here we need a remedy which will cover the state and also will cover the torch infection which has been there and preventing the pregnancy. Here the prescription which I made was a single remedy which was given and which has got a tendency to go to vaginal infections and infections going very deep down and affecting the fertility part. That remedy had to be selected. So there were two remedies which came up, the Merxol and then the Thuja was very prominently there. But looking at to the other characteristics also, that she has fibroids, she has overgrowths, she has no ulcerations as such. So I understood that this is psychosyphilitic. So going towards psychosyphilitic, the anger of Merck is very destructive, very violent, very rage, and very destructive for others. So my prescription was Thuja, which I gave, also gave an understanding that because of frequent injuries, she has developed fibroids also as an part of induration or that fear of being injured, which was there in the past. And now she is very desperate to have a procreation or to have a child. They also had previous history of IUI, but never it was successful. After giving puja, the first follow-up said, ki ma'am, after the remedy, the endometrium has really well developed this time, and doctor said ki for the first time I could see that endometrium is so well developed. So I am very hopeful that this time you will conceive successfully. But still, that IUI went unsuccessful and the spotting and bleeding started. Doctor said ki now we will not take any chance for IUI, so better you quit, better you don't put your head, and we should go directly for surrogacy or IVF. But then the patient had a strong belief in homeopathy and trusted me. She said he can anyways, because it was a recent miscarriage and failure to conceive, we have 6 months in hand. Now, ma'am, I trust you and I want that you should give the right remedy and I will be able to conceive. Then, when I again took torch, she was also being taken torch nil tablet, which was being taken, but nothing was positively working out. Then again, the history was reviewed. Then I found out that when I was reading through notes of Sir, Torch May Sir ne again stressed upon of giving notes and think of remedies which are really deep acting. Thuja was again coming up because she started with all the treatment where the progesterone levels had started improving. So therefore, I reviewed the case and I saw that all things were positive. Just because she's not able to conceive, I was getting impatient that in 3 months I should get the result. So this is impatience at my side, and I should really wait because all the other parameters, all the other symptoms had started improving. The fibroid which was there was not being seen. The cervical discharges, which were usually used to be offensive and which were corrosive, not corrosive, I should say, which were offensive before, had reduced significantly. And now she says ki I don't have that spotting, I have a perfect menstrual cycle. So Thuja has really worked, and to my surprise, we prescribed in October and she conceived in January with a healthy baby which was delivered, and her last menstruation was in December with an expected delivery which was there. And during pregnancy she developed a urine infection and UTI which has developed, and for which, reviewing the totality, during pregnancy there was a lot of vomitings and all. So I had to prescribe her CPR, and after CPR there was nothing which was needed, and she delivered a healthy male baby which was very healthy and hearty. So this was a case where we could correlate with infection. There is psychosyphilis background as a soil being affected, so we had to select something syphilitic, something related to the soil. So therefore, I took the rubric was abortion, miscarriage, and frequent abortions, and also reproaching himself is anger towards self, that is guilt ka root, and touched aversion is again a syphilitic rubric in this case, which is a reaction of the patient to the whole situation she has been suffering. So can we move towards the case number 2? If the another case is a very beautiful and a very short case, another infertility case. So this is a case of septate uterus. Okay. This is a case of a female who had come to me at the age of 31 years, and she said, I have been married since 4 years and still I am infertile. And when on USG, it was noted that there was a fibroid, anterior wall of fibroid, and the uterus was septate, a bicornuate uterus. So if you see a congenital anomaly, structurally over here, again, the structure says that the abnormality is not in the ovary, abnormality is in the uterine cavity. The uterus is malformation of the uterus. So here the problem is related to the development during the pregnancy period. So the Mullerian duct, which fuses to form the uterus, when it fails to unite, it fails to fuse together during the embryological development, the Mullerian duct leads to a septate uterus. It can be a complete bicornuate uterus or it can be a partial septum of the uterus. And I have got 2 to 3 cases of these septate uterus, and all have got good results. She also has the complaints of migraine. The life history of this patient goes like here also she has got a alcoholic father who was into government job. Because she doesn't like the behavior of father in alcohol, becomes very abusive, very quarrelsome, and there is a constant fear in the patient that what happens if father comes drunk home, because again he will hit my mother, beat my mother, and the family discords will happen, which I am really scared of and I don't like. I am really attached to my elder sister, and I used to share my emotions with my elder sister because she was a strong support to me, and I have always followed her because we were from such a family that we did not have too much of money, but we always had importance of the value because mother had taught us the importance of value. So because my sister was very good in studies, she was very honest, I was a person who would follow her. Because the family environment was not good, my mother took a decision that we all should study in a Navodaya convent, which is a government-based school with a hostel facility. So we just go away from the home. But before the situation could happen, fourth standard when I was, my father passed away. So that was a real shock to the family, and I was really in pain and grief. I developed a lot of chest pain when my father died, and I could not, even while narrating the incident, she was crying. So there was loss of support in the family. We had to shift to a small house because we could not afford the bigger house and the bigger rents we had to pay. And since the mother was also educated, she was replaced into the father's job after few years, but we had lot of struggle of hand to mouth when we were in early childhood. So I was knowing the importance of studies, so I focused on my studies and I became so ambitious that I took importance to everything else than the studies, and I really concentrated so hard, worked hard that I should crack the exam, and I went into Navodaya convent. I always had that fear that father would come and fight. So now in Navodaya also, I was not a person who could really get mixed with people and talk to people because that thoughts were always overpowering me. But I was really very good in maths, other activities, dancing, like to participate in stage, and I had that confidence also to pursue every my dream and my goal. My family had lot of struggle. My parents were very good in studies. My father was already into government job. My elder brother and sister, they also pursued government job and they could crack the government services. And I also, at the age of 21, 27 years, could crack the banking sector exams, and I was into a government post. So this was the whole situation. And then at the 27 years of age, I was a person who was very ambitious and determined. There were lot many boys who came to behind me and wanted to just get married to me or flung with me. But I was very clear, if someone was very sincere and honest, I would tell to my family rather than just spoiling my career and looking down upon them. So therefore, when this proposal came into my life, I just referred it to my parents, and then there was a problem because I was always scared that boys should not run behind me and spoil my image. So I was always a good image holder, and therefore I never went into wrong things. Then it was a love marriage, not a love marriage, but it was an arranged marriage, married to a family where I had mother-in-law and a sister-in-law. So the fight was like I had to work 5 days a week. So I always expected my mother-in-law should support in the house chores. Since childhood, I was into a hostel, into work, so I was never into house chores. So always these house responsibilities, I would compare that me and my husband are both into the same job profile. Still, my husband doesn't need to work at home and I have to take up the responsibility, which was really frustrating and annoying to me. Doctor, which I never liked. And I would always feel pissed off when my mother-in-law would give up all the responsibilities of the family upon me, because I felt that my husband should start supporting. Gradually, my husband also supported me into my daily chores. But my mother-in-law was always favoring my sister-in-law, but husband was supporting towards me. And I was very irritated, demanded my husband that you should also work with him. And when in anger, I usually stop talking. My husband says you are very obstinate, and for weeks also I would never bond and talk to him. And whenever things go against my will, I just keep quiet and shut my doors and just lock myself into a room. I always feel that when my sister-in-law comes home, she's pregnant, she's always been given lot of favor. I have to work. I can never sit idle at home. But my sister-in-law, my mother-in-law give all the favors to her. So I always keep pissing behind my husband when she will go, and no, I feel that no one understands me. I feel that I am not belonging to this family and I am a guest to the whole family. I want to conceive so that the family situations might change. I am irritable, but husband is very quiet. So he tolerates my tantrums, and just because I am very much ambitious, I cannot tolerate anything going against my job. If my mother-in-law tells me ki you quit the job and sit at home, I am the person who will retaliate, and I am really seeing to it that I should balance my job and professional life, personal life, so that no one points me out, because I just hate being criticized. Because of the whole family situation, I become sad and depressed. I keep crying when I'm alone, and I don't feel like talking to anyone, because of which I don't have many friends also. I don't hang out, no entertainment in my life, because I'm completely bugged off because of the family situation. According to the husband, he also said that she is a person who is very obstinate. She will never bend down to her decision if once taken. She is very irritable also, and she's avaricious. I really don't give importance to her when she complains about my mother, because she will nag that your mother spends so lot of money, and I always say ki why you are bothered when I am also equally earning about it. So she is not a person who will actually share her things with others. So she is really possessive, but I can understand, because in her childhood, she always say ki in her childhood I had a struggle. So I really feel that I should preserve something for the future. And she always complains that I feel that she's jealous of her sister-in-law. So, and she's so obstinate, she will not talk to, she will not even allow me to cuddle her when she's in anger. So, uterine problems. Here, the conflict is with the womb conflict. There is septate uterus. So, when it comes to septum or the uterus, so here it is like the two uterus. It is actually difficulty to fuse, because it want to give more space. So, it wants to give, it's a partition which has failed to fuse. So there is a separation conflict also over here, that I'm separated. I'm not belonging to the family. And I feel that want to handle more things at a time. This is all there. So because it was related to anatomy, I had to go and ask the conflict which was there in the mother's pregnancy history. So mother said because father was alcoholic and he would abuse me, and so much of torture was there in the family. So always I was not ready for this pregnancy, but he would always abuse me sexually also when he was drunk. So this was an unwanted and unplanned pregnancy, because already I had 4 children, and I was a believer that I should give good lifestyle to the children, and there was a struggle of hand and mouth struggle in the families. No one to take care of us, because husband was alcoholic. There was no support in the family. So I was always anxious that how I will give. So I even had the thought that I should abort this child, and but that thought was not so strong to go to and have abortion. But I always felt that because of this pregnancy, now I will be separated from the children, and now unnecessary responsibilities will come over my head, which I don't want. And I find that the same things are there in this child also. Like, I did not enjoy working in the family at that time. Similarly, this female also doesn't like being working in the family. So this was the whole history, how we connected to the family history. In the previous state, there was a torch positive, so it was more of infection, inflammation, syphilis was really there. So we did not need something coming from the mother's end. Here it was anatomical defect, so therefore the pregnancy history was important. So now, how will you connect it to the rubrics? Can anyone come up with the rubrics of this case, and what is the remedy you want to prescribe to this case? So analysis is that there is a strong responsibility, which is aversion. So we can see a lot of responsibility coming up. The mother is also fighting for responsibility of the children. The patient is also fighting for responsibility of the children. So you have so many responsibility rubrics which are there in the repertory. You have responsibility aversion to, fear of responsibility, wants to give up her. And then we also have a rubric over here, because she already had 4 children, mother already had 4 children, and now this was an extra responsibility and no one was taking care of. So she felt even forsaken, and being left alone also was there. So delusion, neglected, which is there in the mother. There is indifference and apathy towards her own child she is conceiving, and also towards the duties she had. What mother said is, like me, I did not like to have all the responsibilities. Similarly, this child is also not liking all the responsibilities of the family. So here we see a common remedy. If you repertorize, the remedy is sepia. The prescription which was given was sepia 201 dose. And after the first follow-up, which she said was that once the remedy was gone, the menses she had was that bleeding had improved. After a very long time, she said, "Doctor, my bleeding was slightly better." So definitely, sir would always say that when it's a Herring's law of cure and you are taking such cases, improving normal physiology is a good sign and indicator that the remedy is right. But then she came to me and weeping, crying, no desire to talk, nausea was already there, and she was talking, weeping a lot. So I was very sure that CPI is the right remedy to her. And husband also said he is really getting very irritable nowadays, and she doesn't want to enjoy the work. And therefore, I prescribed her was CPR 10 1 dose. Why did I select the high potency? Because I had to hit the psychosyphilitic code which was in the background. The cause was from the womb cycle, and when I have an experience when it is amenorrhea from a very prolonged time and the causes are very deep, these high remedies, high potencies really work wonderful. And for the surprise, she gave me the news that, "Ma'am, I missed my cycle after a very long time," and this is where the pregnancy test also came to the positive with a healthy fetal pole which was there in the left side of the uterine cavity. So therefore, everything started to play an important role, and she also delivered a beautiful female child later on. So infertility was treated and everything was really happy, and even I was very happy. So we conclude over here that in all the infertility cases, select the syphilis which is there, syphilitic reaction which is there, or the syphilitic cause. Try to understand the disposition which the person is suffering. Try to find out the seed, soil, and season conflict, because it is not the maximum time season. Like in torch positive cases, it is the season, but definitely the seed and the soil plays an important role. If it is ovaries, search for the seed conflict. If it is the uterus, search for the soil conflict. Understand what false belief system have gone deeper inside the genetic code, that they don't want to enjoy the earthly gift of being a female, what false belief system they have, and understanding of the environment they have, what animosity they are carrying towards the femininity. So what is the constitution and how it is affected and what is against the nature? And in short, infertility is not merely a pathology of uterus or ovaries. It is a disturbance of the identity, security, and acceptance at the deepest level of the individual. So this was the whole lecture on infertility, a most demanded lecture because this was being asked for so many times for me. Please conduct a session on infertility. I hope lot many doubts must have got clear from your side, and take into a message from my side a beautiful quote by Dr. Einstein, that imagination is more than knowledge is limited, imagination is infinite and embraces the entire universe, stimulating progress and giving birth to self transformation. So in the lecture you must have seen, I tried to correlate the mind to the pathology, to the rubrics which can be the probable outcoming rubrics for infertility. And if you take into notification all the rubrics and go and start working your cases, you will see maximum rubrics fit into the totality and you get the emerging remedy, just match the disposition and prescribe. So thank you. Yes, abortion tendency is really very destructive and syphilitic. So therefore, you can take the rubric of recurrent abortions as a rubric of entry point also if it is very strong. I had a case where there is 6 to 7 histories of abortion. Yes, I have taken that as a syphilitic rubric because that is against nature. ठीक है, चलो, let's call it end of the day. Thank you. Thanks for joining me. Gratitude to all of you for joining us, and thank you.